Hey, how are you doing?
Good morning. I'm okay this morning.
Okay, good, good. Woo. They've been having me running today. So, did you have an you did send me your video. I saw that. So that is good. And then, did you have any questions about your exam, that HIV and AIDS, domestic
I
violence,
have
or
I haven't
HIV?
got the exam yet.
You haven't done the exam?
I haven't got it yet.
Okay. So you need that back as soon as possible.
I'm checking now to see if I got it. Um, no, I haven't got it yet.
You didn't get it from me?
Mm-mm. Nope.
How is that possible?
I don't know. Cause I'm checking now and I don't see anything.
You didn't get it back from me or you didn't do it?
The exam?
Yes.
I haven't got it from you. I've been waiting on it.
Oh,
I haven't got it yet.
you didn't get the results back? Is that what you're saying? I'm still trying to figure out.
Cause you said we're supposed to get an exam today.
Oh, no, I didn't send that out today. Not yet.
Oh, okay. Okay.
But you did. I was just asking you if you had any questions about your HIV and AIDS exam.
Oh no, no, I had got those results back.
Okay. And,
Cause I got an 84% on it.
okay. Was it hard? Everybody's like,
It one part was I was kind of I'm like, oh my goodness. Um, oh, I had it backwards. Number 13, I had it backwards.
okay. Hey, Marquisha. I gotta put y'all on. We have to do like a sign sheet.
Hello, can
Hello.
you hear me?
Now I can hear you.
I missed Zoom yesterday because I was on the floor with the COVID patients and I had to suit up and everything, so I wasn't touching like my phone and stuff.
I can understand that.
Okay,
Mm-mm.
for real. Okay.
Alrighty. So I did check you all out on oh, what are the other things? I checked you all out on hand washing, right?
Yes.
And Marquesha, did we do vital signs?
I need more practice with blood pressure. Like that's I don't know. I think it's like really challenging me. But like I've been trying to like practice and stuff like while I'm at work. And then I've been watching like with the nurses and stuff, like Miss Stacy, she tried to help me. But I don't know. It's hard to me. But that's because I feel like I waited too late to like try to like actually practice.
Mm-mm.
Yeah.
How do you feel about pulse and respiration?
Those are just fine.
Okay.
Yeah.
All right. So let's see.
Do,
So what's the issue with the blood pressure?
By I don't know. When I released it, like because I don't know, maybe I'm confused with the way that I like how much I turn the nozzle to release it. Because when I do, like, it just go straight down.
Okay,
I think.
yeah. So I don't even know. I don't even have a blood pressure cuff right here with me.
Uh-huh.
But when you so when you release the nozzle, so you're gonna all the way right to tighten it. Okay.
Right.
Do it all the way right. And then when you release it, you only release it just a little bit.
Just a little bit.
I think
Yeah.
that's what I did.
Yeah.
But I kept doing it on and on and on.
Yeah.
Like I kept trying it over just to get it.
Uh-huh.
But sometimes when you loosen it up a little bit, it still goes fast.
Right. So, you just have to learn it. You have to learn how it works. How it works for you. While you're learning how to read it, it's going to be challenging because, you want to slow it down so that you can hear the blood pressures, but at the same time, you don't want it to be too slow because you can actually, cause the patient pain, and the pain is going to make their blood pressure go up. But
Hi, I'm Josh Barker.
I don't know. We'll look at this video. How about this? Here is a little video. I might skip it around. We'll see. And see if this helps you. He's talking about doing blood pressures.
Okay.
He's kind of cute too.
And welcome to Blood Pressure Audio-Visual Coordination Skills.
Can y'all hear it?
There are several steps
Yes.
involved in taking a blood pressure measurement, and each step must be completed with accuracy. This is especially true when viewing the blood pressure dial and listening with the stethoscope. You must be able to effectively coordinate what you're hearing with what you're seeing. Just imagine if you recorded a patient's blood pressure as normal, when in actuality, their pressure was extremely high and they were at risk for having a stroke. Your inaccuracy can have dire consequences on the patient's overall health. This lesson will help you achieve accuracy when taking blood pressure measurements. By the end of this lesson, you will identify and interpret the graduation markings on an aneroid sphygmomanometer dial, and determine the systolic and diastolic blood pressure by reading the dial and listening to the carotid sounds. If you ever had your blood pressure taken, you likely noticed that the results were stated as one number over the other number, such as 120/80. The number on top, in this case 120, represents systolic pressure, and the bottom number, in this case 80, represents the diastolic pressure. Let's take a close look at the dial used for determining such a measurement. This is the aneroid sphygmomanometer dial, also known as the blood pressure dial. The dial has the letters mmHg because blood pressure is measured in millimeters of mercury. Also on the dial, you'll notice that there are lines in various sizes. The largest lines represent values of 20. This is 20, this is 40, 60, and so on. The medium lines represent values of 10. This is 30, 50, 70, and so on. And the smallest lines represent values of 2. So this line represents 22, 24, 26, 28, and so on. Now let's use the needle to determine the number displayed on the dial. Concentrate on the tip of the needle and the line that it's pointing to. How much does this line represent? If you stated 68, you are correct. So how much does this line represent? If you stated 112, you are correct.
Okay. So are y'all having any problems like figuring out where the numbers are? Or it's just maneuvering that dial, maneuvering the valve.
Yeah, the maneuver in the dial.
Okay. Yeah. That one is just, you just have to kind of practice it and see what works and what doesn't work. Unless if there is a way that maybe you guys can come in on one of the days that, on one of the, either one of the lab times, Tuesday
That's
or
all.
Thursday,
Thursday.
and then we can work on that. This Thursday though, because we have it's a new start of a new module, we're not going to be doing labs here. We're not going to be doing labs. I'm just having everybody kind of practice their stuff at home.
Okay.
But if you want to come in on Friday, or if you want to wait till next Tuesday when the other students are coming in, you can do that too.
Okay.
I don't know, what day are you on?
Thursday. Thursday. But for sure, I put in for like next month because you know September's almost here.
Yeah.
I requested to have mostly my 2 days, my Tuesdays and my Thursdays off.
Okay.
So hopefully I can be able to come in more then, you know.
Mhm. Well, I'll tell you what, if you can come in like tomorrow afternoon, then we can work on some things.
Okay.
What time tomorrow?
After, like after 12 o'clock.
After 12.
After 12, and that's tomorrow.
I will get back to you.
Mm-hmm.
Oh, I would say I'll try because I have therapy at 3 o'clock tomorrow.
Okay. Okay. So if you can, then that's great. If not, then we'll try to fit it in another time. But
Okay.
that's what I was trying to explain to you, because Sharon, the girl who used to be on virtual, one of the girls who used to be on virtual, she is coming on. She was just concerned about the number of people, so she comes in between 11 and 1. And I only have one of the students who comes regularly between 11 and 1. So, it's not too many people here to worry about passing anything or whatever. So, but either way, whatever it is that you need to do, if we can set up a time that you guys can come in and practice on your skills, we can do that.
Okay. Okay.
Okay. All righty. So, I would just say, like I said, practice makes perfect. You just got to kind of fiddle with it and see what works for you and what doesn't work for you. If you need to watch some videos of people doing blood pressures, that might help you. I don't know, just kind of figure it out as you go. And then, like I said, if you can come in, then we can work on some things and see what we can come up with.
Okay.
Right?
Yes. Sounds good. That's better. Nana, come on.
I did want to show you guys this video. And there's actually, well, I don't know if I'm going to show you the other video. I didn't like it too much, but we'll see. Okay. Definitely this one. So the next skill that we are working on is the unoccupied bed. And did I show you this? Did I show you guys this one already? Do you remember?
I don't know. Maybe we have to play it.
Oh, when she did it by herself, she got all her belongings and then started making the bed.
Yeah.
Yeah,
Well,
we've seen this.
I'll show it again and since Marquesha doesn't remember. So.
Okay.
Thank you.
After performing hand hygiene, check the floor around the bed for spills. Make sure the wheels on the bed are locked. The clean linen should be stacked in the order of use on a clean bedside table or chair. Raise the bed to a comfortable working height and lower the head of the bed. Wear clean gloves to remove the soiled linen. Loosen the top linen at the foot of the bed. Remove the bedspread and blankets separately. If they are soiled, place them in the linen bag. If either is to be reused, fold into a square and place on a chair. Remove the pillowcase and leave it on the bed. Place the pillow on the chair. Move to the other side of the bed and lower the side rail. Remove the soiled linen, holding it away from your uniform. Place the linen in a linen bag, being careful not to shake or fan the linen. If necessary, reposition the mattress on the bed frame and follow your agency housekeeping policy regarding cleaning the mattress if soiled. If you're using a fitted bottom sheet, place it over the mattress from the head to the foot of the bed and pull the corners securely over the mattress edges. Place the waterproof pad lengthwise along the middle of the bed and smooth it out. If you're using a flat sheet, first spread the sheet over the mattress, allowing 25 centimeters or about 10 inches to hang over the side. Make sure the lower hem of the sheet is seen down and even with the bottom edge of the mattress. Then pull the remaining portion of the sheet over the top edge of the mattress. Stand at the head of the bed to miter the top corner of the bottom sheet. First, pick up the top of the sheet about 45 centimeters or 18 inches from the top of the mattress. Lift the sheet and lay it on top of the mattress to form a triangular fold. Be sure the lower base of the triangle is even with the side edge of the mattress.
So this one we don't have to do so much here because we do have fitted sheets, but I do want you to remember this fold that she's doing. It's called a mitered corner. She's going to do it again at the end of the bed, and that is something I do really want you to do, to be mindful of, okay?
Tuck the sheet under the mattress. Be sure not to pull the triangular fold out of place. Then tuck in the remaining portion of the sheet, moving toward the foot of the bed. Keep the linen smooth while tucking all remaining parts of the flat bottom sheet under the mattress. Next, lay the top sheet on the bed with the vertical center fold placed lengthwise down the middle of the bed. Open the sheet out from head to foot, keeping the top edge of the sheet even with the top edge of the mattress. Lay the blanket over the bed with the top edge parallel to the top edge of the sheet and 15 to 20 centimeters or about 6 to 8 inches down from it. If you're using a bedspread, place it over the blanket the same way. Standing at the foot of the bed on one side, lift the mattress corner slightly with one hand, and with the other hand, tuck the top sheet, blanket, and bedspread under the mattress. Then make a modified mitered corner with the top sheet, blanket, and bedspread forming a triangular fold. Leave the tip of the triangle untucked. Move to the other side. Smooth out the linen and finish making the bed. Now make a horizontal toe pleat. At the foot of the bed, fan fold the sheet 5 to 10 centimeters. That's 2 to 4 inches across the bed. Pull the sheet up from the bottom to make a fold about 15 centimeters or 6 inches from the bottom edge of the mattress. Smooth out the sheet, blanket, and bedspread if one is used. Fan fold the linen to the foot of the bed with the top layer ready to be pulled up. Then slip on a clean pillowcase. First, pick up the center of the closed end of the pillowcase. Hold the pillowcase with a firm grip in one hand. With the other hand, open the pillowcase from the open end and fold the back over the closed end, inside out. Next, pick up the pillow with the hand holding the pillowcase. Invert the pillow for the pillowcase to drape over the pillow. Then, pull the pillowcase over the pillow with the other hand. Do not place the pillow or pillowcase under the chin or in the teeth. Adjust the corners of the pillowcase with hands between the pillowcase and the pillow. Do not shake the pillow to position the pillowcase. Apply gloves to handle soiled linen and remove the linen bag or hamper from the patient's room. Then remove and discard your gloves and perform hand hygiene.
Woo. Okay. So, do you guys or can you guys get a pillow and pillowcase? I guess I should have asked you about that before. Let me go for it myself. Okay. So,
Hold on, I gotta check for another pillowcase. Okay, I got one.
all right. So with the pillowcase, of course, normally it's going to be folded. But whenever you gather your supplies, you're going to make sure that you have your fitted sheet, your flat sheet, your blanket, and the pillowcase. And you're going to put them in reverse order. So your pillow, you're going to do last, okay? But in the meantime, your pillowcase, you're going to fold it, roll it up, roll it down like this. And then right on the end of the pillowcase, there should be a fold, it might be a little crease. At the end of it, if you might have a seam, like mine just has a little crease, a line. But you want to grab that, put your hand on grab it so that the pillowcase is inside out over your hand. Yes. And then you're going to grab the side of the pillow that's got the tag. Like this. And then you're going to use this other hand to bring that sheet down over the pillow. And you don't want to shake it down or
I got a long pillow.
and you don't want to put your arm and all that up underneath there because you figure somebody has to come in and lay on that pillow. So you want to try to touch it as little as possible. So that's one of the things that you can do. Practicing, you know, as far as your bed making is that pillow thing. And then fitted sheet is pretty self-explanatory.
Yeah, because she did it side by side. She went to the side that she was on. She tucked that in first.
Yeah. So I'm sorry. So with the fitted sheet, like I said, you're gonna I don't know. It's just basic fitted sheet. And then, let me see.
I'm glad we did that because I had to change my daughter's pillowcase.
Let's see if I can find you. Come on, come on, come on. I know it's on here somewhere. All right. And then this way I can show y'all what I mean when I'm talking about doing the oops. Yeah, this is it. Nobody really. All right. So I'm gonna switch on here. There I am.
What?
Okay. Oh. Come this way. All right, I hope it doesn't. Okay. I'm gonna have to adjust it. Where'd it go? All right, that's better. Look at me in here twice. Okay, so for this one, I'm gonna see if I can show you guys about making the
Bed.
yeah. I want to show you about making that bed.
Okay.
Can you hear me okay?
Yeah.
You can hear me, I can't hear you because I don't have my sound all the way up. All right, so for this one, I already did my one pillow here, so I'm gonna set this on the side. Like I said, for your bed linen, I'll bring it over so you can see it.
Don't you have to have a pad too, like a disposable pad?
Yes, we are, but we're actually waiting for some. We're waiting for some supplies to come in. So once we get the supplies in, then I want some of those cloth bed pads. I don't know. Have you ever
Like
seen?
this.
Yeah. Right now we just do the plastic ones, the paper ones, and so I'm not really worried about those too much right now.
Small ones like this. The ones you can throw in the washing machine.
Yes. Mm-hmm.
Yes.
All right. So I'm gonna have my bedside table. Okay. So I have my pillowcase. I have my blanket. I have my flat sheet. And then I have my fitted sheet. And you don't do what I just did and put it all on your body. We're gonna stack them in the order that we're gonna use them, okay? So, I'm sorry?
Oh no, I was saying it's fitted flat and then the blanket.
Yes, fitted flat blanket pillowcase. All right, so not gonna worry about gloves right now. Normally, whenever you're dealing with dirty linen, you're gonna have gloves on your hands, but we're just simulating, so we're gonna save our gloves for when we need them. All right, so the first thing you want to do is when you're doing this top sheet here, the top blanket, we're gonna do it like we are going to reuse this and just fold it down Make sure you untuck at the bottom of the bed. Fold it again. Because like if you have a patient, say, if you have a patient who they came in and they have to go out for a procedure or whatever it is, and you know you have a minute that you can actually change their bed, you might want to do that. But you're not going to discard the blanket unless it's dirty. And so for this one, you're going to make sure that you untuck your corners. And also take your pillowcase off of your pillow and put it on your chair. Y'all can't see my chair. See if I can turn a little bit more. I don't know if that helps. But so we're undoing this. And then when you undo this, I'm kind of cheating a little bit because you actually want to go around to the other side of the bed. But you're going to fold this up. Fold the linen up toward the head of the bed. Away from your body, just in case there's anything in there that might spill or soil. And while you're folding it, you're going to check it to make sure that there's no sharps or anything in there that would could possibly stick somebody else or make a mess. So we're going to put that in the dirty linen, quote unquote dirty linen. Okay, first thing we're going to use is your fitted sheet. Also, if you need to wipe down the mattress, whatever, you're going to do that in between. Fitted sheet. Now, most often in a lot of the assisted living or skilled nursing facilities, you have housekeeping that's going to do bed changes, but you never know. And then if you work in a hospital setting, you might still have to do a bed change. So basic putting on a fitted sheet. Make sure your sides are covered. Also, before you start making the bed, you want to raise it up to its highest level so that you don't injure your back. Raise it up to about waist level or right below your waist level so that you don't injure your back. All right, are y'all still with me? We okay?
Yeah, I'm here. Yeah.
Okay. And then you're going to use your flat sheet. And I have it folded a certain way so that when you open it, it actually is going to be it's just going to open easier. Now you don't want to, you know how we do, you don't want to do this to put the sheet on the bed. You want to lay it flat and then you're going to just gradually open it so you're not fanning it in the air. I'm going to bring this so that you can see on the flat sheet. Hopefully you can see it. It's going to be these two loose ends here, this end and this end. And then there's this folded part right here. That you need to have toward the center of the bed. And then what I'm going to do is I'm going to grab this outside folded part. And I'm just going to pull that down on the side of the bed. That makes sense?
Yeah.
Okay. And then for this side, I'm just going to grab this other fold right here that's on the top and pull that over down on this side of the bed. All right. Now we're going to go to our blanket. And I think I'm going to reuse my blanket that I had. But normally what I want to do is your blanket, you're going to use the same style to open the blanket. This one is being reused, so it's not, it's on here a little bit different. So we're just going to unfold it from the bottom, lay it over the top of the end of the bed. And then I'm coming over this way. And then pull this up to the top. And now when you're at the top of the bed, you want this to be about you want the blanket to be about 5 to 6 inches down from the end of the bed. About 5 to 6 inches down from the end of the bed. So I'll show you like this. See? This is about 5 to 6 inches down from the end of the, where you have your top sheet.
So you just
Okay.
fold it over on top
Right.
of it.
Yeah, and then, yeah, we're gonna do that at the end. But right now, I want you to fold in the under this top sheet and the blanket. You're gonna fold that in. Top sheet and the blanket. And then on this side,
Or the
you're going
corner.
to do the mitered corner. So you're going to come out about a foot and grab the sheet and the blanket and fold it back onto the mattress
Triangle.
like that. So it's flat or relatively flat. And then you're going to come over and you're going to push this underneath the mattress, that whole corner, so that this is flat here on the outside. And then you bring it down. Sometimes you can just bring it down, or you can bring your hand, hold your hand to bring it down. And then you have what's called your modified mitered corner on this side. Y'all see my little corner?
Yeah. It's different when you're doing housekeeping because they make you tuck the whole thing, like even the
Yeah.
side.
Right. But you have to remember that when we, you have to remember that when we do these beds, it is in anticipation of a patient coming into bed, and we need to make it as easy as possible for the patient to get into bed.
Okay.
So once again, your corner on this side, you're going to tuck it in and do your corner over here. I don't know why this one looks funny. Okay. And then once you do that, you're going to make your cuff up here at the top of the bed. And I'm going to have to do a video to show y'all, do a video when the students are here to show y'all the occupied bed. My cuff is sloppy. Okay. And then if you have an unoccupied, and then the last thing you're going to do is your pillow. I forgot about that. Okay. Then you have your bed here. And then once again for your pillow, do it on this side. You're gonna take your pillowcase and bunch it up. On either side. And then you're gonna grab that, right there's that fold crease that's right in the center. You're gonna grab that crease, or at least have your hand open underneath it. And then on the tag side of the pillow, the side with the tag, you're gonna grab that pillow and then just pull it down over the, pull the pillowcase, pull the pillowcase down over the pillow. And then for the beds that are on where, what you want to do with the end of your pillowcase is, instead of folding it, you're going to leave it out flat. And what it's going to do is, when you come in the classroom, if you're in the bed that's on the other side over there, the pillowcase is going to be facing outside to the wall. If you're in this bed or doing this bed over here, your pillowcase is going to be facing the open end towards the outside wall. Okay? And that is the unoccupied bed. All right, so I don't know how you guys, however you can work it, I need you to try to practice that. And then if we do a video that you can demonstrate that, or if you want to do it on a live, on a Zoom.
Yes. Yep. Like I said, I want you guys to practice that. However you can do it. You know, Marquesha, you got your little patience there. Maybe you can practice on some of the beds that you're doing. And if you're, you know, Maria, you want to kick your kids out the bed so you can make their bed. Oh, you got cribs? Oh, I see. Yeah. Well, you can do your bed. Can you do yours? I can't hear you now. You're on mute.
I got to move it from the wall, but I can try it.
Yeah, you can try it. See how it does. And then if you guys have any other issues or questions, you can always watch those videos on YouTube. I do have those videos. They are in my, what do you call them? They're on my playlist on my page. There's a playlist that's got all the different videos, and I have them labeled so that you can see them. And then I'm gonna try to see if I can upload this video. I had an issue with the other one the other day. But
yeah, I didn't see all the videos.
Yeah, so you can do that. All right. Y'all have any other questions?
Nope.
No, I got you down, so I can't hear you. Marquesha, did you have any questions?
No. I've been caught up in my own time. So that's why you hear me talking.
Oh, okay. All right. All right. Well, all right. That's it for me today. So I need for you all to, if you can come in tomorrow afternoon, we can work on those vital signs, that blood pressure and the blood pressure cuff. Or if you can come in Friday afternoon, or Monday afternoon, or if you can just come in on Tuesday with the other crew on for labs, whatever it is that you can do, just let me know so that I know how to plan my day, and we can do whatever we need to do to make sure that you are good that you're comfortable with that. I know that it's hard for y'all to get in. So I'm trying to do as much as I can with you as far as the virtual, but there's some things that you just, you know, I don't know. I'm kind of limited. We're kind of limited. All right.
Were you done with her? Were you going to be feeding Miss Burr?
Yeah.
Okay.
Yeah.
We actually positioned her, put her on her back, and put her head of her bed.
Okay. So, all right. Did you all
I
have?
just came in.
Yeah, I know. I know. Hey, Anna.
Hi, sorry I got on here late.
Oh, okay. We're getting ready to get off, but I did record the Zoom meeting, so you can go on my YouTube channel and watch it. And
Okay, no problem. Thank you.
okay, sure. And then we're not having Zoom. We're not doing lab on Thursday because we have new students coming in for the new module. So we're not doing that. But also today, I'll be getting your exam to you today. Your final exam, I'll be sending that out before 5 o'clock today. So be looking for that. What else? Nothing, no, but we will be having our regular Zoom at 11 o'clock on Friday. Regular class Zoom at 11 o'clock on Friday. And we'll have new students in too. So I might have to do some adjustments to what we do, but we'll just go forward.
Okay.
Okay? All right, that's it for me today.
All right, thank you.
You said we don't have Zoom. We don't have Zoom when?
Not
Until
tomorrow. Not tomorrow. Tomorrow you're going to work on your final exam.
Right. Okay.
And then that needs to be back to me by 5 o'clock tomorrow. So I'm going to get it out to you by 5 o'clock this evening, but it needs to be back to me by 5 o'clock tomorrow.
Okay.
And then no Zoom tomorrow, no labs and Zooms on Thursday, but we will have a Zoom on Friday.
Gotcha.
Okay.
All right.
All
Thank
right.
you.
If I don't have anything, your HIV and AIDS, your domestic violence, I need that. I need that.
Did you get mine?
Yes. Didn't I get yours?
Domestic violence?
I did. Yeah.
Okay.
Oh wait, what's the domestic violence? You had a quiz?
It was a little paper. They did watch 3 videos and I sent out an email. I think I did. Did I send out an email? And then you write a 50-word paper. You don't remember an email? Did I not send one out?
Oh no.
All I got was the Survey Monkey.
Lord.
I don't think you put that in there. Hold on.
That's because I mentioned it in the Zoom. I didn't remember to send it back out.
No, I missed it. Okay, when is it due? Tomorrow?
Yes, actually it was supposed to be done, but as soon as you can. It's just a 50-word paper on if you have had any experiences with domestic violence, something about that, or if you know someone who's experienced it, and then a list of some of the resources that are available for people who have experienced domestic violence.
Okay.
Let me see if I can find it here. And then I'll forward it to you guys. All right, so I'm gonna send it out to you now, Marquesha, and well, I'm gonna just send it out to everybody just in case somebody missed it if they weren't on Zoom. And then, like I said, we'll be back on Zoom. You should be looking for that exam this evening. We'll be back on Zoom on Friday, and Yeah, so Thursday is kind of like a little break. All right?
All right.
All right. That's it for me, unless you guys have any questions.
No, thank you.
All right. You take care. Bye-bye.